U.S. taxpayers save $7 for every dollar that the government spends on family planning. Yet more data, ladies and gentlemen, about what our priorities should be when it comes to the budget and spending. Publicly funded family planning programs help taxpayers save billions of dollars every year through a number of mechanisms. Number one, it averts costly medical expenses, according to a new analysis from the Guttmacher Institute. This is the largest data point in what is now a growing body of evidence that says there are huge societal benefits, both in terms of culture and in terms of economics, when it comes to funding family planning, sex education, and contraception. And the religious right wants to hear none of it. They don't care. They say they want to reduce the number of abortions, but they don't favor any policy that would actually do that. They just want to shut down abortion clinics. It's not hard to understand why it is so fiscally conservative to fund family planning. Low-income women are at the highest risk of unintended pregnancy, in great part because they don't always have access to medical resources like contraception. When you put together a program like Title X that helps provide women, low-income women, with birth control, it makes a huge difference. We have that study from St. Louis recently, which shows us that the number of unintended pregnancies and thus the number of abortions goes down when you provide access to birth control. Guttmacher researchers estimate that the care provided at publicly funded family planning clinics, listen to this, ladies and gentlemen, helped prevent 2.2 million unplanned pregnancies in 2010. Do the math. Some percentage of those would eventually be terminated pregnancies based on elective abortions. This prevents abortion, Lewis. It's so clear, it's so simple, and the religious right doesn't care. They don't want to hear it.
Week after week, we just see more evidence that if you make things easier and safer for people and for families, not only is it the right thing to do, but it ends up saving money.
Not only because of this, though, Lewis, but also because of, do you know how expensive it is to treat cervical cancer and to treat STDs? And when you think about the screening and the prevention, it saves you so much more. And it's quantified here. It's $7 saved for every dollar spent. That's a pretty big return.
And I think, unfortunately, religion is a big part of the problem here.
Yeah, that's a factor. And it's also, as we've talked about, this strict father morality. And when you look at it, there's this kind of weird contradiction. Because on one hand, Republicans don't want all these would-be liberal voters from poor people, from black people, all the groups that the right unfairly paints as these irresponsible child bearers, right? We've heard these horrible racist stories of welfare queens that with Cadillacs that never existed when Ronald Reagan told the story. At the same time, so on the one hand, they believe that all of these children will eventually become Democratic voters, right? And they want to prevent that. At the same time, they want abortion to be illegal. They don't want to provide the resources that would prevent unintended pregnancies. And putting aside the fact that they don't seem to realize that when somebody wants to have an abortion, they figure out a way to have an abortion. There's almost just a dumb contradiction. They don't want a demographic shift, as they call it, that will create more Democratic voters. And at the same time, they don't provide the resources to prevent unintended pregnancy and reduce abortion. It makes no sense, even at its immoral base, Lewis. It makes no sense to me.
Yeah, it's completely irrational and illogical, but I don't know what's getting in the way. I guess religion, misinformation, the strict father morality, it's a mess.